For women to access services, it's their right. To access family planning, to access information, to access delivery services is their right.
The Ministry of Health has welcomed the UN technical guidelines of incorporating the human rights-based approach to health in dealing with maternal, newborn and child health.
A big number of women are dying in this country is first of all because they don't know that is their right.
Without knowing that they have rights and having access to the information about the policies and laws that guarantee those rights, then it's very, very difficult to be able to act on them. But even with information, then systems need to be set up so that when you act, something happens.
Dr. Anthony Mbonyi, the Director of Health Services in the Ministry, however, says that the duty bearers who are the service providers are ignorant of these rights. Professor Florence, a retired obstetrician, says that a lot of what the experts consider to be human rights is not added into the ethical code of conduct of the health workers.
We need to be educated as providers so that we understand exactly what human rights are.
A UN officer working the Human Rights Office in Geneva, Lucinda O'Hanlon, says that the human rights-based approach to health has been around for long, but implementation has been difficult.
It really requires a mind shift from seeing people as passive beneficiaries of a service to rights holders with legal entitlements. So it means that the rights holders, people, need to know that they have rights, and responsible authorities need to know that they have obligations to fulfill those rights.
Alfonso Baragues, the human rights advisor for UNFPA based in New York, says that human rights approach to health puts emphasis on accountability issues.
Which means that yes, governments have responsibilities towards their people. It's true that they make many commitments, that they pass legislation, that they write policies, but these need to get implemented.
Not necessarily individual accountability targeting doctors or health workers, because they also have rights to work and rights to have just conditions of work, but accountability of the system as a whole. How is it organized to ensure the realization of these rights?
Alfonso also says some countries have dramatically reduced maternal mortality.
For instance, through the recruitment, training and deployment of midwives, that has been fundamental in ensuring the antenatal care, which can reduce the risk of maternal mortality, but also countries where a lot of effort has been put in empowering women as equal members of society.
To the UN rights advocates, such countries go to extremes in applying the normative contents of the right to sexual and reproductive health, with emphasis on maternal, newborn and child health. While progress has been made, it has been painstakingly slow. Scaling up is a challenge for many countries.
Health services, goods and facilities need to be accessible, available, good quality, and acceptable to women, for instance, and to adolescents. It means that these services need to be accessible without discrimination. So women should be able to go to a health facility regardless of whether their husband agrees or not that they should go.
According to Uganda's UNFPA representative Esperance Fundira, people need to demand for these rights. She urges those in authority to go the extra mile in fulfilling the commitments to improving the health of women and children. To her, if only 50% of the recommendations in the human rights approach are integrated in Uganda's healthcare system, the country would be better off than it is, and conditions like fistula, which degrade women, would be reduced. Florence, NTV.